Over to you, Marion.
Hello, everybody. Welcome to our second session on compassion. My name is Marion Lynch. I am a nurse and I work for THET, and I've been working teaching people on the front line for the past year, and noticed some of the strengths that people have got from working, but also some of the issues that have gone on. And that's why I'm very interested in helping us develop compassion personally and systematically and societally as well. I teach doctors and nurses, and one of my students, her first job is ITU, and she came home to her place and she drove up and she couldn't get out of the car. She'd had 3 people die that day. She's 21 years old, and nothing in her training prepared her for this, and she couldn't get out of the car. And her housemate came out and just got in the car and sat with her and cried with her until the nurse was ready to get out of the car. And there was something very moving about that when they told me, because there's a presence and a kindness that needs to be shown that can't be prescribed or just given or fixed. We need to show some compassion to each other. And compassion is empathy plus action. And her friend standing in the car, standing outside the house, getting in the car and then staying, was the biggest way that that nurse could get some kindness to herself and be able to go to work the next day. So that's what we're talking about here, those moments of small moments of kindness. And what we did this morning was started to share how we have shown compassion and experienced compassion from colleagues in this time of COVID. And what really came out was the challenge that people have to notice how they care for themselves and how they care for colleagues. We're very used to talking about how we care for our patients, but not necessarily the other way. And what did come are that the small things make a big difference. So people who have done something quietly without being asked to, sitting with someone, looking after someone's personal space, witnessing moments of compassion, such as just noticing somebody needs a helping hand, and either organising their rota in a way that helps them live, or smoothing out the way to actually ensure that they can get their vaccine or something like that. We talked about where organisations and religions and faith play a part, and how the work of people outside of the health systems have enabled us to learn from them in the way that people from faith communities or communities show and share compassion that clinical colleagues don't necessarily do. And then we spoke about maybe this is because we haven't been trained or been given permission to show compassion to ourselves and to each other in the same way that we have to our patients. We also spoke about how difficult it is to be compassionate digitally, and how the experience of being in a room together and being able to hold a silence and enable people to reflect on their own inner thoughts is quite easy when you're in a room together, but quite hard when you're online. And yet there is a challenge now that in order to move forward, we're going to need to be able to create a safe place where colleagues can feel connected online, that can feel that therapeutic sort of support from themselves online, because we won't necessarily be able to be in the same room, but we'll be on a Zoom quite often. So the challenges of caring for ourselves and caring for our colleagues are not only systematic in terms of what's not available, in terms of some of the health products, but also within ourselves. It's a risk to step forward, and a risk to step forward online and with people we don't know. And there's therefore a call to action from me is, if we don't step forward, who's going to? If we don't look after ourselves, who's going to? And if we don't look after our colleagues, who's going to? We do it so well with our patients and in our other communities. We need to flip that up and start to look after ourselves and understand and recognise our own vulnerability as well as our own ability. And we can do that online, if we get some different skills, and we can do that if we get a system around us, a safe system, which is what we're going to speak of through the rest of the session now. So my message to anybody here is, you've got this. When it's been really hard, it has really been hard, and you are with a group of people here today who know it's been really hard and who are ready to say, we can look after ourselves as well, and we will look after ourselves as well. We just somehow will collectively design what needs to happen, because governments can't design what needs to happen. We as clinicians need to design what can happen, and bear witness to the experiences we've had to date, and recognize that we've got the skills. We just need to turn them inwards to ourselves. That's me done.
We have Dorcas joined, if you'd like to hand over.
Hello, Dorcas. I'll hand over to Dorcas now, who's my colleague who was in one of the breakout rooms, and will share her experience of that process and moving forward what it is she thinks is hugely important. Dorcas.
Thank you very much, Marian. Our lives are stories, and as the Nigerian writer Ngozi Chimamanda said, there is more than one story. And today we gathered under an African tree and we heard stories of courage, humility, solidarity, empathy, peace, love, and the power of the collective in the face of sheer vulnerability. We also validated the power of silence. Thank you to all who shared the intimate stories today of compassion. And thank you to my family at THET and our colleagues at ESTA for providing us with a safe space to tell our stories and share and feel the art of compassion. I'm tasked today with examining the themes that were raised from the sessions that we raised this morning, and introduce 3 key speakers who will be speaking into compassion, quality, and empathy. When we looked at the themes, we broke them into 3, and we examined compassion to ourselves and others. Some spoke of interventions and abstracts, and some spoke of acts of kindness, important to feel cared for. Some spoke of witnessing moments of compassion, such as facilitating breathing space, taking over shifts from overwhelmed colleagues. Compassionate moments with our patients, simple things such as sitting and feeling with them, cleaning their homes and getting shopping done. The sense of sitting with grief was discussed. What do we do with all this grief and trauma that we're experiencing? And the sense of not feeling alone through our grief has been raised. Some spoke of others doing something for them, quietly, without being asked to do so. Others spoke of helping others to feel better protected through wearing their PPE as they looked after our patients. Others spoke of opportunities and innovation to weave in compassion and safety training through our PPE shifts when we're wearing our PPE. Are those moments of compassion as we're going about wearing our kit and rotating off COVID wards and accommodating our family requirements? The art of shopping came up, the gifts, and the supermarket. Are there opportunities in the supermarket that we can be compassionate? Are we saying good morning to each other and caring that much more? And somebody said, now that we're all digital, what are the opportunities and challenges of showing compassion digitally? Can we truly be compassionate and feel compassion through digital modes and communication such as WhatsApp, Facebook, Twitter, and Clubhouse? And what about young people? How are they experiencing and formulating compassion? We turn to the healthcare system then, shall we? And examine the healthcare system, because compassion sits in a position between the healthcare system and the individual and society. Colleagues said we were trained to be compassionate to our patients, not to ourselves. Oh, how humbling and very honest. And the question came up whether medical professions are taught enough self-compassion and compassion for colleagues, not just compassion for patients. And I will add my colleagues in midwifery and nursing and all the other fields And as my colleague Shams at WHO always says, very inclusively, what about those who support the healthcare system, such as porters and cleaners, and those who volunteer in our service? Others spoke of the importance of other institutions, such as religion, and what role they play, how people feel and give compassion through religion, whether it is the presence of a religious figure or going to a religious worship place. Can this be translated as compassion and quality? Others spoke of feeling cared for by the organization and feeling safe through innovation and weaving compassion. And this has been brought up several times. How do I feel that my organization cares for me? And we rounded off the themes then by looking at what people are looking for. What are the opportunities? What are the pockets of opportunities that we can weave more compassion through? Others said we must appreciate the transformation that has taken place. None of us will come out of this the same. We must allow a sense of normality to return, whatever normality it means now. Ensure validation and a sense of collectiveness in order not to feel alone. The role of innovation and compassion. It becomes the duty of healthcare system then to provide a safe space to us who work on the front line and serve society at the highest honor on earth. But we must have safe spaces and care for our own physical health, our own mental health, and our well-being, because the greatest asset of a healthcare system is its staff, is its workforce. Others said we need a hub to share our stories and understand our feelings and feel our feelings and fears and express our fears and share our vulnerability, because we are vulnerable. And bringing art into the compassion into safety and quality and ensuring there's a balance that must be achieved. And others spoke of an academic space. Should the field of academia think more about how to bring compassion into COVID discussion? And lastly, creating new and different relationships outside our professional lives, which to me leans very heavily on my own profession, which is mental health. How do we keep ourselves well? There is a price that will be paid out of this pandemic, which is our own mental health. And it is the job of healthcare systems and our own individuals to look more deeply into compassion. I'm thrilled to introduce three speakers who will be speaking today into the very issues and the themes that we discussed today. And I introduce John Alexandra as he takes over the floor. Thank you very much.
Good afternoon, everybody. Thank you very much for inviting me to this exciting conference. And thank you for asking me to share my experience of compassion within a COVID context. Just to give you a background, I am a children's intensive care doctor, and I've been doing children's intensive care for the past 30 years. But last year in March, on March the 24th to be exact, our adult intensive care unit had become completely overwhelmed with the first surge of COVID-19 cases. And they asked us in the children's intensive care whether we would be able to help them. This is obviously a bit of a concern, but we thought about it, we agreed to help, changed all our systems around, and on March the 31st, we admitted our first adult patient with COVID-19 needing intensive care. We looked after these patients for about 6-7 weeks, and I'm going to pick on 3 points of compassion that I feel that I have gained from during that experience. The first actually was on the morning of the 31st, as my PPE buddy and I were donning our PPE, doing our final checks. And I remember I looked into her eyes and I could see the fear there. And she looked into my eyes and she could see the fear there. Behind our masks, we gave each other a wry smile and we walked in through the closed doors, because we knew what we were walking into was something that we'd never been trained for. We were going to be looking after a group of patients that we had never ever looked after before. We were used to looking after babies weighing 3 to 4 kilos. Now we had adults weighing 120 kilos. we're going to be looking after patients with a disease that just 3 months previously, nobody had even heard of. It hadn't existed. And even in March at that time, very few people knew how to manage these patients with this lethal disease. And importantly, we were going to be looking after patients with a disease, if one of us had contracted it, we stood the risk of dying from this disease, because we had heard reports coming through of nurses and of doctors who had died from this disease. So we did our morning checks, and then we got around and we stood around in a circle and we shared our fears. We talked to each other about our fears, about our ability to look after the medical issues, about our ability to keep ourselves safe, about our ability to look after our families when we went home. And we made this a regular occurrence. Every morning we would get together and we would talk about what worried us, what were the issues that we had concerned about. Sometimes we were able to solve the issues and sometimes we couldn't. We just had to accept that we were there and we had to do our best. The second point of compassion arose a few weeks later when one of our younger members of staff said that she found it quite distressing looking after the adult patients, because until now, she'd only looked after children. She was still quite young, she didn't have a family and didn't have that emotional attachment of looking after children. But when she looked at the adults lying in their bed, she was thinking, this could be my father, this could be my grandmother. And she felt quite distressed by that. And the learning there for me was, that hadn't occurred to me because I was used to looking after sick patients who were young, but at that point, I learned to relate to these people as potentially colleagues, as potentially partners. And the final point of compassion arose, unfortunately, when we got to the stage where we lost a couple of patients. At that time, there was no visiting allowed. And when we got to the stage where we had to withdraw care on these patients, we realized that we had to be that patient's carer and we had to be that patient's family. We had to be the medical team that withdrew the intensive care. And we also, for that person at that time, had to be their family, holding their hands, wiping their brows, saying, sleep in peace, may your God be with you. We stopped looking after adults after six weeks, and then we were concerned that our staff may have suffered significant moral distress. So we did a survey. Actually, it was quite encouraging for us, because what our staff told us was before they started, about 80% were not confident about going in there and looking after adults. But at the end of their 6 weeks, 90% said that they were confident to be looking after adults. And in fact, when we asked them, would you do this again, 72% said yes. They would do it, but only within the context of working in our unit. We hoped we wouldn't have to do it again, but unfortunately in January, we were asked to help out again. And again, we took patients with critical care, but this time we switched around from within 24 hours from a children's unit to an adult unit, and again looked after patients for 8 weeks. So reflecting on these experiences, my thoughts about compassion is that compassion is not about pity. Compassion is not about sympathy. And I'm not sure compassion is about empathy either. What I think compassion is the ability to acknowledge your own humanity, your own weaknesses, your own strengths, and your own fears. It is the courage to admit that to other people, to admit your fears and your weaknesses and your strengths. And it is the willingness to recognize the same humanity in the others, in all the people around you, the people you work with, and the people that you care for. I think if we're able to do that, then we will be able to bring out the best in ourselves and the best in everybody else. And that is all that we can ask for. Thank you.
Thank you very much, John, for reminding us of how flexible we can be when we have the right support, how adaptive we can be with the right support. Thank you. May we move on to Nick? Pao. Nick will be talking about organizational psychological well-being. Thank you, Nick.
Thanks very much, Dorcas. Okay, so I'm Nick Pell, Chief Executive of the Society of Occupational Medicine, and I really recognise that compassion is a kind of underlying kind of human need, and something that obviously healthcare workers give a lot of. But in this current crisis, from a kind of occupational health perspective, there are reports, as I've put up on the chat, about fatigue, grief, demoralisation, burnout, stress, and feeling overwhelmed, and that's where kind of compassion can run dry. But I suppose we need to differentiate between sort of mental health that's sort of diagnosable, and then sort of mental health issues like anxiety and stress that's not a kind of actual medical condition. So we're not clear that actually there will be, as I've sort of slightly tabloidly done, a tsunami of PTSD. Actually, people are coping, even though there are pressures in terms of home restrictions, the shift working. I mean, on well to sleep day to day, actually, we're concerned just by how tired people are, and then people having crashes, and as they go to and from work, it's very, very common for people on shift works to unfortunately die in car crashes. And that includes healthcare workers. But I suppose putting in that context, as I've been asked to do, and Dorcas introduced me as, in terms of the organisation and what's critical, and again, I've put up on the chat, is good management, and that management understands the role of compassion, that there is good management, there's a sense of purpose. And Neil Greenberg, who's our board member, has talked about moral injury, or kind of the sort of hazard of that happens when it crosses over your own sort of moral compass, and compassion is gone, and people are asked to do things I think as just sort of immoral and unethical. So that is a turning point, obviously, as it's compassion fatigue. Next slide. So I suppose what we try and do is put it in sort of primary, secondary, and tertiary approaches to what I put as managing work-related stress, and how organisations, taking that perspective rather than individual perspective, need to look at things. So the primary one is within the organisation, by changes to job design, so people aren't overworked, they're not so tired they kind of have the crashes, travelling to and from work, but also the shift patterns, work well with good management and support. And the second one is secondary, resilience, building individuals' ability to cope. And that's not about blaming people, their own resilience. Resilience training for individuals, I think, makes me very angry, actually. And it's more about creating those structures where people can kind of recharge organisationally. And tertiary is that kind of individual support, which ideally we should come in the primary one. So going to the next slide, just to unpack this in more detail. I mean, primary is kind of the so we missed out on the slide there. Is the one to go for. Here we go. Primary interventions. Thanks very much, Jess. So primary interventions, they're the most effective, but the least common. And organisations often think, investment in occupational health, that's not worth it, or there's no point. It's seen as kind of costly. But we've been, Ben's been very kind, Ben Sims, Chief Executive of that, sort of saying how we've been advocating for risk assessment approach. And so, I mean, in the time of COVID, but generally, what are the key hazards to organisations or healthcare workers? It's not just PP. PP is the last sign of defence. It's form of defence. It's taking a Swiss cheese model. Cheese has got holes in it, and putting those protections in place to remove that risk. And I said that basic kind of Maslow hierarchy of sort of what your needs is, to feel safe and protected, and that risk assessment approach for COVID is really important. So what we hear is that there might be no kind of transmission of COVID in ITUs, but certainly there's been a risk. This is in the UK. There's huge risks of people donning and doffing, hugging each other, going to the mess, and the COVID transmission in that way. And this is not about blaming them. This is about creating a system where people can still experience compassion for each other without COVID transmission. So managers obviously have a really important role in that, to help people with sort of protocols, donning and doffing, testing, making sure sort of the protection is right in terms of PPE. The secondary interventions, that's helping people cope more effectively. And, you know, that is kind of things like reflective groups, things like today, looking after oneself. But, you know, again, it's not about blaming people. And if they can't self-care, it's the organization, the healthcare system and organizations need to support people with this area. And the last one is tertiary interventions, which is supporting people back to work. You know, if people have come off, they're stressed out, you know, maybe they have got PTSD, and occupational health again can advise on that. Particularly, we've done advice at the moment in terms of if you've had COVID, and help people return to work, you know, in a staggered way, in a sensible, compassionate way. Next slide. This is sort of about staff well-being, coping, and the space between, I think, you know, between teams, between people, making sure the conditions are right, the connections are right, and the communication is right, so people, you know, don't have contradictory information. There is connections between people, that there is the conditions that are right in terms of intensity and routines that are safe. Next slide. Oops, there we go. Good practice. So, you know, from an occupational health perspective, it's really important at the moment. You know, we have to be practical about this, and, you know, compassion is a practical aspect, but, you know, I'd like to see compassion and good practice, and that is focusing on safety and the hierarchy of prevention, things like flexibility around working hours, staff involvement, decision making, all kind of good management practice, connecting with colleagues as we're doing today, and skills training and preparation, so people have the time to have breaks, have a work-life balance. It's very intense time, and, you know, it's management, leadership. Good support for management is important, whether you're off sick, on return to work, as well as during your time at work. Next slide. So, summary. Everyone's working harder than ever. It's really tough. People need support. Events like this can help create that solidarity between countries, people across the world. We need dedicated and targeted support. Occupational health is part of that solution. It's often not, it doesn't exist in many countries. We're here to help. There's a global network that can help as well. And it is a very difficult time, and we can provide lots of tools and support to you. So really pleased to be part today, and I'll hand back to the chair, Dorcas. Thank you.
Thank you, Nick. So we're hearing from Nick there saying, do not panic. This is not a tsunami. We got it in hand, speaking very much from an organization perspective, and saying we need to find a balance between safety and infection and prevention. So we've heard from John speaking from a lived experience perspective, Nick speaking from an organization perspective. And one thing I picked up from Nick there was the importance of communication. And I love seeing leaflets being translated into different languages in England, just to raise awareness on COVID. So the position and the power of an organization. We move on now to a more societal position and perspective on art of compassion. And I hand over to David Okello. Thank you, David, for joining us.
Thank you very much. I am really thrilled with what I have had, starting with Dorcas. I thought the issues I'm going to talk about have been really well covered already, but let me add my voice. This is an important subject, and I think we need to disseminate the ideas from here widely, because they are important for health workers. So I'm going to talk about strategic and societal issues. But let me start with, next slide, please. Let me start with my definition of compassion. I think a lot has been said already, but in my view, compassion should encompass the recognition of the suffering of others, and then take care, after recognizing, take care to help them. After recognizing that they're in trouble, we should take action to be able to help people who are in trouble. That, if we don't do something, if we just recognize it and don't do something about it, I think it's also a problem. Compassion must embody a tangible expression of the humanity of love for those who are suffering. Really, this is very basic to our core creation as human beings, we must show love to others and must show love to those who are suffering. And really, if we can do that, we are talking about compassion. It also encompasses a desire to alleviate the distress of others, a desire from within ourselves to really alleviate the suffering of others. That to me is another critical issue in compassion. It's the knowledge that there can never really be any peace and joy for me until there's peace and joy finally for you too. That knowledge is extremely critical. And of course, the question is, how does this relate to employee performance and the well-being of employees? Those definitions have some critical words in them. I want to carry them along in my discussion. Now, the background of all this, of course, healthcare workers have carried heavy burden during the current COVID crisis. They are shouldering a lot of issues, caring for patients and looking after themselves and looking after their families and so on. So supporting their psychological well-being must continue to be a priority. This is why for me this workshop, this conference is extremely important. We must continue to look after ourselves, look after the healthcare workers. We should be able to identify risk factors. These people are suffering and sometimes we let them jump over the cliff. We should allow ourselves not to create a situation where people with maybe silent mental problems just turn over to overt mental issues. And this is extremely, now if you see people looking after sick people, there's a very delicate line that could turn out badly for healthcare workers. Now the experience in Uganda, if I can go over it, next slide please. Frontline health workers have raised serious concerns here in Uganda where I am based. Perhaps the biggest concern is that of fear. There is general fear of all sorts of things. When you talk to healthcare workers, they will tell you about PPE not adequate or they are not of the right quality, they are not enough in terms of quantity and so on. That is one fear. But also there's a risk associated with direct contact with patients. And they fear that because they're exposed in the wards, they're exposed in the intensive care units, they are going to be infected. But above all, they have seen their colleagues die in the line of duty. Colleagues they are sitting in ICU with. So if your colleague died yesterday, will you really have the courage to go back to work? These are serious problems we are facing here in Uganda. But also they have concerns about their family. Families will be infected because they work over long hours. Families are not being taken care of. Will I infect my children? Will I infect my spouse? Serious concerns. And they also are overworked, I must say. These people are working around the clock and there are emotional strains associated with it. There is also physical exhaustion from working over time and so on. And many of them are burnt out, really burnt out. So this is a problem of overwork, overload, and so on. And they are also stigmatized. They are highly stigmatized. They are being avoided by colleagues who are not working in ICU. They are being avoided sometimes by their family members, but also by the community they work, they live in. If they know that you're working in ICU where the COVID patients, you are a problem. You are stigmatized. People don't want to come to you. They work under a lot of pressure. These are common things we are seeing. These people are suffering. So we need to quickly come up with how do we help them deal with these common situations. These people over the board to have serious mental breakdown worries me. They have risk factors I have noticed, limited supplies of PPE, even sometimes they have no water, no disinfecting materials. they have limited supplies where they're working. They're working under a lot of pressures, as I've seen, and they have limited support from management sometimes. They are left on their own. First of all, their pay, you cannot talk about the amount of money they're being paid is peanuts, and yet they must continue to work. And that's those three things for me are things I have identified as things we should always bear in mind. So what can we do? Next slide, please. I am proposing a number of things. The need to display greater kindness and empathy towards our colleagues could not be overemphasized. This was talked about earlier, but I think we need to re-emphasize. We really need to show kindness and empathy and love to these colleagues who are suffering with all kinds of pressures. This is essentially about health workforce management. Health workforce management, unfortunately, I must say, is a neglected topic in most of our management systems here. People get employed and everybody thinks you have a salary and you're not given any kind of support beyond your pay. And I think we need to pay attention to this. Employers should love the people they lead and win their trust and feel for them, feel for each other and share their pains. I really want to emphasize this point. If you don't love your workers, if you don't share their pains, then what are you leading? What are you helping? What are you trying to do? And this is what compassion is about. The need to ensure sufficient rest should be given to these people. They should be given time off, and they should be provided with basic tools to do their work. It really worries me when I interact with these people and they don't have adequate, even gloves. Sometimes they don't have gloves. I talked about PPE, but other things too. We need to ensure that they have basic tools to do their work. It's a difficult thing. Build leadership and capacity and awareness among supervisors and leaders at all levels. I think sometimes the leaders at all levels, not just Ministry of Health, hospital leaders, hospital managers, we need to build that capacity on issues of compassion. If it's a recommendation I'm putting forward, I think this is something we need to take seriously. Sometimes we have people who are just looking after, have you accounted for the money? Have you accounted for the goods you have in the hospitals? And nobody cares about accounting for the well-being of the people working in there. We need to raise population and community awareness to the issues faced by our healthcare workers. This is important, very, very important. Sometimes it's the people we serve who are insensitive and they are traumatizing the healthcare workers. How can we go around this problem? How can we sensitize the population to be aware of what these people are going through? Stigma, I talked about it, is a problem, but it does not help if these people are stigmatized and even given negative comments and given negative connotations and so on. We need to show more love and what we can do to deal with this problem, in my view, in the hospitals, in the wards, but also at the society level, in their communities, and in management as a whole. I think this topic of compassion needs to be preached. We need to find a way of reaching out to all people concerned. Thank you very much. I'll stop here.
Thank you very much, David. Thank you for reminding us how vulnerable our continent is. Thank you for reminding us that stigma has a significant role. Our continent is not new to stigma. We've been here before with many pandemics, HIV, and many other challenges that come to our continent. Thank you for reminding us the role of leadership in this. It's important that we have the right leadership and the role of community engagement as we spread the word. Thank you. May I hand over now to Karen Frame, who will weave us through the role of culture and take us through these themes as we ride through. And allow me to thank my co-host, Marion. Thank you, Marion, for your support and guidance through this session. Over to you, Karen. Thank you.
Sorry, I forgot to unmute. So just to say thank you so much, Dorcas, and thank you so much, David, as well, for really highlighting some key aspects of compassion and actually compassionate leadership. And I've been asked to try and draw things together and then help us as a group actually look at how we can take compassionate leadership forward really within organizations. And I guess my first thought is actually the world with COVID is facing something that actually strikes at the heart of humanity and the heart and fabric of our society, and has led in many ways to the loss of many of our natural human support mechanisms in terms of contact, in terms of being together to support each other, as well as causing a horrific amount of loss in many ways. What I think I've been struck with though throughout this is actually the solidarity of health workers and in this meeting in particular across continents, and actually what drives us and motivates us in essentially our service to our patients. I have been very struck by a comment on how, you know, as health workers, we're very trained and focused on being compassionate to our patients, and that drives many of us, but that isn't without its cost. And actually we sometimes are not kind and compassionate to ourselves and certainly to our colleagues. And there's this concept that as clinicians we need to be strong, we need to support this patient and this event that and this patient who may be passing, or this really difficult situation the patient's in, and support them and their family through that, but equally stay strong, because we've got to cope with everything else that's going to come in and follow. And there's that clinical reserve, but behind all of that we're all human, and actually many of our patients and many aspects of what we do in our clinical roles will resonate with us as a person, as in our own lives, with our own families and our own lived experience. The moments of compassion people described earlier in our groups, those small acts of kindness, those small acts when, whether it's a manager thinking about your shift and making sure that you rotate and have a break off the COVID ward, whether it's sitting with a colleague who's overwhelmed with the distress of losing several patients in a shift and just being, those small acts of kindness, maybe some donation, feeling cared for, have been are so important, and sort of how that can fire us up and just keep us going. Let's just, before we move on and think about actually, you know, how can we create this culture of compassion? I think it's almost there. I think it's in many of us, and perhaps there's some need to allow us to be compassionate to ourselves and others and staff as well as patients. But just that reminder of David's particularly definition of compassion, that how you must recognize, first of all, it's about recognizing that suffering and that distress, and then not being afraid to respond to that and to act to support another human being. And I think elements of this is about humanity, this is about being human as much as being a professional. So just like to move everybody on now to really think about the question, the big question that maybe we can take with us into our professional lives and make changes, perhaps, is how do we create the culture of compassion that helps us support psychological well-being, but also helps us maintain compassion towards our patients and maintain quality of care. So I don't know who would like, I think Louis, you have some thoughts that you'd like to bring to this question. So it'd be lovely to begin to hear from the floor about some perhaps solutions and things we can take home.
Hello, Karen. Hello, colleagues. Happy to be here. I'm Luis Akwegbe, medical doctor by training, public health physician, currently serving in Liberia with the World Health Organization. But I will share, experience and some thoughts from my work as a clinician in Cameroon, also as a district health manager in Cameroon, and some of the work I do within the non-profit, the non-profit organization sphere. So yes, a lot. I want to thank sincerely the presenters that have delved into the depths of compassion, and also for the organizers. But first, to respond to the question, how do we create or co-create a culture of compassion? I think to start with a saying, somebody said, culture eats strategy for breakfast every morning. To emphasize the very essence of culture in whatever we do, because once we have the wrong culture, cultural practices, whatever we put forth as strategies, as plans, goes down the drain. And so it's a very important question. And I will start by saying that the first thing I think is to cultivate self-compassion, because it has to start from within. We heard about compassion fatigue mentioned by Nick, which is very true, because the more we get stretched and stressed by the current settings that we find ourselves, COVID, or be it routine health service delivery where the conditions are not met, like David said, maybe poor infrastructure, poor salary scales, all of that, just weighs you out. So you have to cultivate compassion from within, because what you don't have, it will be impossible for you to share that to others. And so how do we, just to strike on a few points, develop self-compassion? First, we have to be mindful. So we have to be mindful of our setting. We have to be mindful of our capabilities. We have to be mindful of the shortcomings, mindful of the responses of the systems in which we work, knowing that things would take time to come, to the expectations that we have, but also acknowledging the fact that at times we might not get the results that we anticipate. And so that mindfulness is very important, but also accepting our vulnerabilities, our weaknesses, because most people shy away from, exposing what the weaknesses they have. And then secondly, I would say we need to produce compassionate leaders and organizations. So from the self-compassion, we need to create organizations that are compassionate. And this takes a number of things into consideration. Yeah. First, in our organizations, we need a growth mindset. A mindset among workers to grow despite the challenges, to improve, but also psychological safety. We need organizations where people can be open to express their frustrations, can be open to challenge the status quo, can be open to, to contradict even decisions of management. So that is some of the things that we need. But resilience within the organization, where it has been mentioned about support systems of staff, is very important. Beyond just the work they do, how are their families, faring? I had this experience as a district health manager, and once we started developing extracurricular, if you may, but activities outside the technical sphere on a more social level, I realized that I had the opportunity to know things that my staff, were struggling with. And once you share with them, it gives them more courage to actually, belong and be part of the team and put in their best.
Yeah. Thank you so much.
Yeah,
thank you so much, Lewis. That's I'm aware of time. I think we've only, unfortunately, we've only got a couple of minutes left. And just so thank you so much for that, because there are many elements to that, but a safe space for staff, I think, and that culture of compassion within the leadership and acknowledging the limitations in which we're working, really helpful. Thank you. Do we have time for one more comment? Don't know if anyone else has anything they'd like to add.
Yes, please. My name is Petronella. I just wanted to say, unfortunately, I joined late, but I think one of the things that we should be thinking about is having emotionally intelligent leaders who, yes, with compassion, it's all about empathy and putting yourselves in others' shoes, but very much more understanding each of your teams and how they internalize and understand, what is going on with each one of them. And most of us, we deal with it, differently, and therefore that is really important to kind of put emotional intelligence with, amongst that, because each individual will be taking this and dealing with it differently. And therefore, whatever we do in terms of assisting and guiding needs to be very much individually tailored for the individual. Thank you.
Thank you. Thank you. That's a really valuable contribution, because everybody is so different. So just in terms of organizations and managers being open, have their eyes open to their staff and actually what's going on for them, and being able to reach out and other people reaching out to other colleagues. Thanks so much, Petronella. Anyone else to add anything? Oh, Peter, you've got a hand raised. Yes. Peter, your hand's raised. I don't know if you'd like to add something. I think you're unmuted. Maybe it's a legacy hand. Anyone else who'd like to comment? We're over. Just a last comment, or no? I think we're over time, so we should close. But I would just really like to thank so much my fellow panelists, and also our contributors, and from the chat as well. I think clearly this is such a central part of needing to support our health workers, who are the healthcare system, and some really valuable thoughts. So thank you so much. Dorcas, I don't know if you have any last comments.
No, other than to say I'm really proud to be part of the third family that brings together these conversations, that reaches out and collaborates with others, and says, let's come together and have this conversation. I'm a frontline nurse. I can tell you that my eyes are on the front line, but they're also back home. And today it's been really heartwarming hearing from colleagues from the continent on their realities on the front line, and also what they're asking us to do. So this is a call for us to go away today and bring something else to the front line other than ourselves. Bring a sense of compassion, bring a sense of empathy, and listen. Just listen to others. Yeah. Thank you.
Thank you. Thank you so much. Okay. So I think we'll close the session, but just to say thank you. It's been a real privilege to participate in this real global communion of health workers. So thank you so much, everybody.
Thank you.
Thank you.
Now, may I...
David, you're on mute.
Naomi,
Yeah, go ahead.
are you the one sending the links? I need the link to the next session.
I can do. Yep. I'll if you